My name is Sanjay Puri. I'm the chairman of the US-India Political Action Committee, and you have to be living under a rock if you've not heard of the healthcare debate that's raging in our capital. And one constituency that has not been heard from is the Indian American physician community. 60,000 of them, physicians, interns, students, and 10% of the entire physician body. And so we decided that we need to bring a good sampling of them from this region to talk to you, express their points of view, and tell you what this health reform bill means to them. So let me introduce our wonderful panel today. I have Dr. Suresh Mutta, he's an internist. Dr. Rosie Singh, she's the family practitioner with 5 other physicians. Dr. Rahul Jindal, who's a transplant surgeon at Walter Reed. And Dr. Merlin Vemuri, who's an internist, but also is the director of assisted living facilities. They say the United States spends over $2 trillion on healthcare, but still ranks at the bottom on several quantitative and qualitative indexes in industrialized nations on healthcare. Premiums are going up from $5,000 in '99 to $12,000 today. All a recipe for changing the current healthcare system. Would all of you say that we really need to fix what is currently the health reform system?
No disagreement.
No, I agree it needs to be fixed, but the disagreement is on the extent of how much needs to be fixed.
Dr. Singh, why don't you tell us some of the key measures that are being proposed? There are 2 Senate bills and 3 House bills that are working their way through Congress, and there will be some measures that will come out of it. It'll be important for our audience to know from your perspective how the key things that are going to impact their health care.
One of the key things is providing coverage to almost every U.S. citizen. And the second provision would be not to deny access to health care because of pre-existing conditions. And another important provision would be not to have any discriminations for coverage on patients based on their age, gender, and of course, you know, everybody have to think about how it's going to be paid for, and payments to achieve all of the above or some of the above through reducing payments to Medicare and increasing taxes on wealthy American citizens.
Well, at least some of those measures seem to be pretty good. Dr. Jindal, there's a lot of talk today about the public option. Every day I pick up the Washington Post, etc. They say it's the public option in, public option out. You're at Walter Reed, which is kind of a public option in their facilities. Can you explain to the audience what does the public option mean? Is it effective? How is it going to work? And what can we expect?
Public option is effective at Walter Reed because it's a close community of people in the Department of Defense and their dependents. So that is different. But I don't know how it will work when it is taken to a massive scale of 300 million people trying to insure everyone.
But the public option is an effective measure. I mean, they're talking about that is going to be one of the options, not everybody is going to have public option, so to speak. Now, one thing that every time I meet a physician, and I'm sure all of you kind of address this, is the conversation always comes down to caps on medical liability or junk lawsuits or tort reform or whatever the expression is. Dr. Singh, can you tell us why should there be caps? And if somebody has been injured through negligence, let's say, of a physician, why should they not get paid for whatever the damage has been done to them?
I think I'm in agreement that the patient should be reimbursed to the fullest extent of the injury if it was deemed to be because of a negligent act from a provider, whether it's a physician or nurse practitioner or a PA. But I think all of us in the medical community is acutely aware of the fact that that's not necessarily what's happening here. There are quote-unquote emotional distress awards that are outrageous in numbers. There are a lot of frivolous lawsuits that are being brought in because there are no repercussions otherwise. A lot of physicians are practicing defensive medicine, ordering unnecessary testing, rather than, you know, using just the clinical judgment, having a good rapport with their patients. I really think that there should be a cap as to how much a lawyer can make in each lawsuit that they represent. I don't think there should be necessarily any caps on to bodily injury or any real injury that a patient suffers.
Now, obviously, this is not making its way in any of the bills that is currently going in there. But that, you think, is not just important to the practice of medicine that as all of you do, but it's also important from a patient's perspective. Do they get more tests hammered onto them?
Definitely, I think it has a large part to play in what a physician does, because oftentimes something that you could use your clinical judgment in dealing with certain things are not really being used that way, because we need to order extra tests. We have to make sure there's blood tests, there's EKGs, there's X-rays, there's CT scans, MRIs, on and on and on you can go down the road. And many of these are thousands of dollars, and it's really expensive when something can be dealt with quite simply. Certainly, these tests have their role to play in the diagnosis and treatment, but the way things are handled right now is it's being taken to the extreme, and thousands of dollars are being spent, and these are very precious dollars that we should be using in deciding how to spend it on our patients.
No, that's an excellent point. Dr. Mutta, there are a lot of studies that show that the system in the United States today is fairly inefficient. What is your perspective?
Healthcare expenditure is just escalating. Healthcare cost comes under like 16% of the GDP, which is the highest among industrialized nations. So in spite of all this, 45 million are still are uninsured, and the people who are insured are also not getting the appropriate care. So definitely there has to be some change in the healthcare system. For that, we have to see what a dollar amount goes to the healthcare. About 31% goes to hospital care. About 21% goes to physician and clinical service.